Great. Thank you, Hannah. Thank you for the invitation to present to this group today. And thank you for your introduction. It's a real pleasure to be with all of you today and talking about ways we can manage anxiety in the context of blood cancers. And I'm going to say up front that I use the term managing anxiety because when we're going through something like cancer, or when we're dealing with something like cancer, anxiety is a very normal reaction. And so it's probably not realistic to think that you will never feel anxious. But what we're going to talk about today is ways that you can manage that anxiety so that it doesn't have as much negative impact on you and your loved ones. So that's our hope for today. So I just want to note that I don't have any financial relationships to disclose, and also to acknowledge the funders for the work that we do here. So here's what I'm hoping we can talk about today. So I'm going to start with talking about the basic characteristics of anxiety. And then we're going to shift to talk about anxiety triggers. So what are the things that might bring on anxiety for you? And then we are going to talk about a way of thinking about those triggers, which will lead us to think about strategies for managing anxiety. And it's really that last point that we're going to spend most of our time on today. So first, let's talk a little bit about what is anxiety. We've all experienced anxiety, so I am sure you have a sense of what anxiety is, but I want to make sure we're sort of all thinking about the same thing as we get started here for today. So the first very important point is that anxiety is a very normal reaction to something that is dangerous or that is a threat to us. And really, anxiety is designed to help protect us. It's the way that our brain and our body warns us that we might be in danger and that we need to do something to protect ourselves. And so you might have heard of the fight, flight, freeze reaction, right? Fight or flight response. And this is a response that we naturally do when we feel we are under threat, and is triggered by our anxiety, right? It's triggered by our brain telling us something bad is going to happen. So we either need to fight back, we need to flee, we need to get out of here, or we need to stand very still. We need to freeze until the danger passes. So these are all very normal and helpful reactions. The problem is that our brain can't distinguish between something like being chased by a bear and having to go to an oncology appointment. To our brain, right, to sort of the basic part of our brain, those two things are the same kind of threat. And so our brain triggers that anxiety reaction. The problem is when we're going to an oncology appointment, that anxiety is not helpful, right? Because we don't need to run away from the oncologist, right? We don't need to fight the oncologist. And so it's in those settings where the strategies that we're going to talk about today can bring down that anxiety so that we can better function in those situations and also just not have that uncomfortable feeling of anxiety. So the main reason that I share how normal anxiety is so that we understand that it's not a weakness. So sometimes I have people say to me, I'm feeling so anxious, I should be handling this better. And that's not true, right? Again, anxiety is our normal reaction to a threatening event. So if you're having anxiety, it doesn't mean that there's something wrong with you. That being said, right, we want to help manage anxiety because it's uncomfortable, right? It's not a pleasant feeling and it reduces the quality of our life. It can also make daily life difficult, right? If you're feeling very anxious or worried all the time, it can be hard to do the things that you need to do during the day. And then it can also interfere with relationships. If we're feeling anxious and worried and worked up all of the time, we're not as able to engage with the people we love. And that can put stress on those relationships. So even though anxiety is a normal reaction, it doesn't mean there aren't things we can do to help bring that anxiety down. So let's talk a little bit about your experience of anxiety. And so I want you to think about some of these questions, because the first step to managing our anxiety is to be aware of when we are anxious. And there's certainly common symptoms of anxiety that I'm going to go over next, but everybody experiences their anxiety a little bit differently. So these are some questions you can think about to really understand how you experience anxiety. So for example, how does your body feel? So we know that anxiety has a very strong physical component. So does your body feel differently when you're feeling anxious or worried? What emotions do you have? Do you feel nervous, for example? Right? So thinking about the physical and the emotional. The other piece of anxiety is our thinking, and we're going to talk about this a little bit more in a few minutes. But the way in which we think can drive our anxiety and also be driven by our anxiety. So reflect a little bit on what thoughts go through your mind when you are feeling anxious, and are those thoughts increasing your anxiety? If some of these questions are hard to answer for you, and they can be hard because reflecting on our own emotions can be difficult. If you're having trouble answering these questions, it might be worth asking a loved one what they notice in you when you're in a stressful situation. Maybe they notice changes in your body language or changes in how you talk or speak. Maybe they notice that you're more tense in your body. And so asking someone who knows you well might give you some insight into how you experience anxiety in these different ways. So again, spend some time thinking about these questions to help give you a sense of how you experience anxiety. There are common symptoms of anxiety, which are listed here. And like I mentioned, there are both emotional symptoms of anxiety and physical symptoms of anxiety. And both of these groups of symptoms are very common. So on the left, you can see some emotional symptoms, and these probably make sense in terms of your experience of anxiety. So for example, feeling very nervous, worrying a lot. And with worry, it's worry that keeps coming back. It's sort of difficult to control those worries. You might feel restless or kind of on edge in terms of your feelings. For some people, when they're anxious, they're very irritable, so they might snap more at other people. Anxiety can cause difficulty concentrating. So that's another more emotional or psychological symptom of anxiety. And then, of course, disturbed sleep is something that can come out of these emotional symptoms. There are also physical symptoms of anxiety, which you can see listed here. And a common theme of these physical symptoms is that they reflect that your body is kind of revved up, right? Or activated. It's like the knob on your body kind of turned up the speed. And so you might have rapid breathing or pounding heart or stomach pain, right? Because your body, when you're feeling anxious, is sort of turned up, right? It's more activated. Muscle tension, for example, is a really common symptom of anxiety because we sort of tense up when we're feeling anxious, right? And people often talk about having discomfort in their neck and shoulders because they're sort of clenching these muscles. So these are all physical symptoms of anxiety. Now, some people have both. Some people have more emotional symptoms. Some people have more physical symptoms. So that's why it's important, like we talked about on the last slide, to really think about how you experience anxiety. Now, one of the tricky things with anxiety when we are talking about it in the context of cancer is that there can be overlap between symptoms of anxiety and symptoms of cancer or cancer treatment. So here are just a few examples. I mentioned that having a racing heart can be a symptom of anxiety. Of course, there are some medications that can also cause that racing heart feeling. So it can be hard to differentiate between the two. Shortness of breath, sort of feeling that tightness in your chest, can be a symptom of anxiety. It can also be a symptom of deconditioning, right? Like if someone is recovering from treatment and they've had to rest more, they might not be maybe as fit as they were before, which is certainly fine, but obviously that can cause some shortness of breath. Tingling again, a symptom of anxiety, but can also be a side effect of chemotherapy. So this can make it difficult to determine whether a symptom is because of anxiety or because of something related to cancer in treatment. So how do we manage this? The first and most important point is to discuss all of your physical symptoms with your medical team. Even if you think it might be anxiety, go to your medical team first to report those symptoms, just to make sure you can get a full, whatever workup you need to understand where those symptoms are coming from. And then recognize that physical symptoms, right, that might be from some medication, for example, can trigger anxiety. And then anxiety can also make those symptoms worse. So if you're having a physical symptom that's because of something on the medical side of things, that can influence your experience of anxiety and vice versa. So again, it's really important to make sure your medical team knows about all of your symptoms, even if you think they might be because of anxiety. So anxiety is very common in people who are going through cancer. And I think this is important to highlight because sometimes people aren't sure if their experience is consistent with how other people are experiencing cancer or not. So we know that about 14% of people with cancer meet diagnostic criteria for an anxiety disorder. These are criteria set out by the field of psychiatry to describe different anxiety disorders. So there are symptom lists that people, the doctors review to determine if someone has an anxiety disorder. Up to 50% of people with cancer have elevated anxiety that doesn't meet the criteria for an anxiety disorder, but is still very stressful and uncomfortable. So what these numbers tell us is that quite a large proportion of people with cancer do experience elevated anxiety. And so if you are experiencing this, it is something that is pretty common. Now, that doesn't mean we can't do something about it. We certainly can, and there are good treatments. But you're not alone. We also see high levels of anxiety in caregivers of people with cancer, again, with up to about 45% of caregivers reporting elevated anxiety. And we know that if a loved one has anxiety, the person with cancer is also more likely to have anxiety and vice versa. And this makes sense because we live in close proximity, right, to our loved ones. And so if one person is anxious, the other person is also likely to be anxious. So let's shift a little bit and talk about what we refer to as triggers for anxiety. Well, these are the things that increase your risk for becoming anxious. So these are some questions to ask yourself to try to identify your triggers for anxiety. So you might be able to think of situations that every time you're in them, you feel anxious, or maybe there are certain people that make you anxious. Maybe there are certain worries that anytime they come to mind, you start to feel that anxiety feeling, right? Nervous, worried, kind of revved up. If you can identify those triggers, that is helpful because one, if possible, you can sort of avoid those triggers. Now, that's not always possible, right? And so if you can't avoid the trigger, it's helpful to know what it is so that as you enter into that situation, you can be ready to manage your anxiety with some of the strategies we're going to talk about in a few minutes. So it just helps us understand what are the situations that put me at higher risk for feeling anxious so that I can be ready for them. Now, the last point here is that sometimes anxiety does come out of the blue, and that is very normal experience. You might be going about your day, everything is fine, you're not feeling particularly stressed, and then anxiety just kind of hits you. If that happens for you, the strategies that we are going to talk about in a moment will help you manage that anxiety. So how do we think about strategies for managing anxiety? So you might have heard of the cognitive behavioral model of anxiety or cognitive behavioral therapy. This is one really common way of understanding how anxiety works. So what you see in these different bubbles are factors impacting anxiety. And you can see that all the arrows go in both directions. And that's because all of these things influence each other. And what this model focuses on is our thoughts, so what we're thinking and how those thoughts impact our anxiety, our behaviors or what we're doing and how those impact our anxiety. And then when we're talking about thoughts and behaviors in the context of cancer, we want to think about physical symptoms. That might be from treatment or from recovery, because those physical symptoms are also going to impact our anxiety. Let's look at an example of this so we can make it a little bit more concrete. So let's say that someone has the symptom, I'm sorry, in the blue bubble of shortness of breath. They're starting to feel short of breath. That thought or that symptom triggers the thought in the green bubble, what if my cancer is in my lungs? Right? So they feel shortness of breath. They have this thought. Of course, that thought increases their anxiety in the red bubble. So now their anxiety has gone up. Because they're anxious, they don't feel like being around other people. So they cancel all of their social activities. That's the behavior in the purple bubble. But now that they're not doing anything, they have more time to think about their cancer, right? The green bubble. Those thoughts increase their anxiety even more. They cancel more social activities. Now they're just sitting on the couch, so they're losing fitness, so they get even more short of breath. That makes them think more about their cancer, and their anxiety goes up even more, and so on and so on. So you can see how these things interact to make their anxiety go up and up and up and up. What we're going to talk about next is how do we use this model to bring that spiral down, right? To reduce anxiety by changing thinking, by changing behaviors, which further reduces their anxiety. So before we talk about some concrete strategies, I just want you to reflect on what makes your anxiety better and what makes your anxiety worse. And the reason these questions are important is because you may already know things that work for you. And if they work for you, then we want to think about how you use them even more, right? How do you use them as you enter into a situation that might trigger anxiety for you? If there are things that make your anxiety worse, then we can think about, okay, how do we pull back on those things, or how do we manage those things better? So you all have experience with your own anxiety. And so tapping into that experience to help manage that anxiety better can be one way to get started in terms of these strategies. The other nice thing about this model of anxiety is not only does it help us explain how that spiral might work, right, with higher and higher anxiety, but it gives us places to target to help reduce that anxiety. And so what I'm going to talk about next are some strategies for the purple bubble, behaviors that can help us bring down anxiety. And then I'm going to talk about strategies for thoughts that will also help bring down anxiety. So let's talk about some behavioral strategies. So again, we're in that model that we just talked about. I'm going to go through 4 behavioral strategies for managing anxiety. Some of these are probably familiar to you, which is great. The reason I like these strategies is because 1, there's a lot of research showing that they work for helping manage anxiety. And then 2, they're pretty straightforward. So they're not very complicated, which is great because it means we can learn these quickly and we can also use them pretty easily in our daily lives. Okay, so let's start with deep breathing. Deep breathing is a very effective strategy for managing anxiety because it targets both the behavioral symptoms and the emotional symptoms. So on the physical symptoms, deep breathing helps calm your body down by reducing the amount of oxygen you are getting into your body. It helps with the emotional or psychological side of things by giving your mind something relaxing to focus on instead of focusing on the thing that is making you anxious. So if you've done yoga or meditation, this is probably very familiar to you. If you haven't, let me go through a few cues to help you do deep breathing correctly. So it's called deep breathing because the goal is to breathe from your diaphragm, which is sort of low below your chest around your belly button area. So we want to avoid short, shallow breaths like this. We don't want that. We don't want our chest going up and down because that's not deep breathing. We want, as you're doing deep breathing, for your abdomen to go in and out. And that's what's being shown in that picture here. Those arrows are pointing to your diaphragm, which is what should be pushing up and down as you do deep breathing. So how do you do this? So to get a deep breath, you want to breathe in through your nose and then breathe out through your mouth with pursed lips like this. Okay, so in through your nose and out through your mouth. You also want the breathing to be steady and controlled. So counting can help with this. The number of counts doesn't really matter. If one count feels comfortable, do one. If 2 or 3 feel comfortable, do that. You just want to avoid holding your breath. You don't want your chest to be getting tight. If your chest is getting tight, reduce the number of counts. So you want to keep it very even and controlled. So think about smelling flowers and blowing out candles. Or I had a patient give me one that I also thought was good. She said she imagines smelling her soup and then blowing on her soup to cool it off. So whatever image works for you, use that. So the idea is you're going to breathe in, breathe out, breathe in, breathe out. So you can see it's very controlled and slow and deep, right? So you're not seeing my chest go up and down like before. If it helps to put like a hand on your chest and a hand on your stomach to sort of cue yourself to breathe deeper, do that. So that's deep breathing. I recommend that people do this. You can start by doing it for a minute and then go to 2 minutes and 3 minutes. Practice it during the day when you're not anxious, so that in times where you are anxious, you're better at it. So that's deep breathing. Let's talk about muscle relaxation. So muscle tension is very common when people are experiencing anxiety. And progressive muscle relaxation is just a way to move through your body and release all of the tension. So what you do is you start at your head and you just focus on releasing the tension in your forehead. And then just keep moving down. And how you break up your muscles doesn't matter. Just keep moving down your body. You might then go to your face and your jaw. You know, sometimes people clench their teeth when they're anxious. And so just focus on reducing the muscles in your face and jaw. And then you focus on reducing the muscles in your neck and shoulders. And then you can relax your arms. And you just keep moving down your body, relaxing all of the muscles one step at a time. When you get to your feet, you want to scan back up to find any remaining tension. Because sometimes what happens is by the time you get to your feet, your jaw is clenched again. And so you just want to go back, find that tension that might have reemerged, and relax those muscles. So again, this is just a step-by-step way for relaxing any muscle tension that you have because of anxiety. Oftentimes people will tell me, well, I don't really have muscle tension. And that might be true for you. But I recommend that people try this anyway, because oftentimes what happens is people tell me, I don't have any muscle tension. And then they try progressive muscle relaxation and they come back and they say, oh, actually, I did have tension. I just didn't realize it. And so give it a try. And I bet you'll find some muscle tension somewhere that you can focus on relaxing, which again will just calm your body. So I mentioned that it doesn't really matter how you break up the muscle groups, and it really doesn't. So don't get hung up on, should I do my forehead and my cheeks or just my forehead, or don't worry about that. As long as you're moving down your body and releasing the tension, that's fine. Here is a very simplified way of grouping the muscles into 10 components. So if this works for you, feel free to use this. But again, there's no magic in how you break up the muscles. What's effective is releasing the tension. So third, let's talk about guided imagery. So guided imagery can be really helpful um, when your thoughts are going, right? And when we get anxious, we often have racing thoughts. That's one of the symptoms of anxiety. So I often recommend guided imagery when people are having a hard time falling asleep. In that space between lying down in bed and when you actually fall asleep is sometimes the time your brain decides to think about everything that's stressful. Guided imagery can help in that moment. Guided imagery can also be helpful during procedures like scans, when you have to sort of lie still, and there's no distractions happening. Guided imagery can be helpful in bringing down anxiety during those times. Guided imagery is very straightforward. You are picturing a relaxing image in your mind. So you might pick your favorite vacation spot, your favorite place in your home, the beach, the woods, it doesn't matter, anywhere that you find relaxing. And what you want to do is you want to fill in that image, with as much detail as possible. You really want to make it live. The questions here are just some prompts to help you do that. What do you see in this image? What do you hear? Are there people with you? What do you smell? How does the air feel on your skin? Because what you want to do is engage your mind as much as possible in the creation of this image. And that has two benefits when it comes to managing anxiety. The first benefit is that instead of thinking about everything that is stressful and that you're worried about, you're thinking about something relaxing. So it addresses that psychological or emotional component of anxiety. The other piece of it is that it can help calm the body down because those worries are not causing that activation in your body. So it helps calm your body down, and it also gives your brain something relaxing to focus on. So again, this can be helpful when you're trying to fall asleep, for example, when you need to sort of be lying still, but you need something for your brain to focus on that's not stressful. So the final behavioral strategy that I want to talk about today is activity planning and pacing. So sometimes what happens when we are feeling anxious is that because we're feeling anxious, it's harder to engage in activities, and it's harder to engage in activities we enjoy because we're distressed, right? We're worked up, we're worrying, we're pacing. So we're not engaged in things that feel important or helpful to us. Because we're not doing as much, we feel worse, and then we do even less, and then we feel even worse. What activity planning and pacing allows us to do is to reverse that cycle so that we do a little bit more, we feel a little bit better. That allows us to do a little bit more, we feel even better. So this is the idea behind activity planning and pacing. What does it look like? Well, first, identify activities that are meaningful and enjoyable to you, right? And so that could be anything, right? That can be visiting with friends and loved ones, reading a book, going for a walk, anything that you find enjoyable and relaxing. So identify those activities. Then we want to modify those activities to account for any physical symptoms that you have, right? So we want to be realistic about what you are able to do. And one way to think about this pacing part is that you don't want to do an activity that exacerbates or makes worse your symptoms to a very high degree, because then you're going to run yourself into the ground. So I often see this with people. They'll have a day where they feel really good. They're so excited that they feel really good. So they do housework and errands and meet a friend, and they fill their day. And then they're so tired that they have to rest for 2 to 3 days after that to recover from their good day. And instead of having those up and downs like that, we want to have it a little more level. Now, of course, you're going to have some bumps, right? Some days you just feel more tired than others, for example, but we want those bumps to be smaller rather than these big spikes. And so think about doing an activity until you're at about a 5 on a 0 to 10 scale of that symptom. So once you hit a 5, let's say in fatigue, then it's time to stop and rest a little bit until that fatigue goes down, and then you can do something else. So this is a way to just pace yourself as you're doing activities so that you don't have those big spikes in physical symptoms. So once you have a meaningful activity, you've figured out how to pace it, then you want to make a plan for actually engaging in that activity. The more concrete you can be, the better. So scheduling a day and a time and the person you're going to do it with. I often tell people, write it on your calendar like it's an appointment. That's how important this is. Because by doing more, you are going to feel better in terms of your anxiety. And then feel free to be flexible. Try different activities. The first thing you try might not really help. Maybe you don't enjoy it as much as you thought you would. So try something different. The idea is we want you to increase in your participation in activities that feel satisfying for you, so that you're spending less time sort of worrying about the things that are stressful. So those are the behavioral strategies for managing anxiety, things that we can do to bring our anxiety down. In this next part, I want to talk about our thoughts and how our thoughts can drive our anxiety. And so you can reflect for yourself on what thoughts make you feel anxious. What are the things that go through your mind that you notice increase your anxiety symptoms? And we're going to talk about ways to manage those thoughts. So these strategies are often referred to cognitive strategies because cognitions are a different word for thoughts. So these are really strategies for managing our thoughts. And this can be tricky because our thoughts are often automatic. They just pop into our heads. And they pop into our heads before we are aware of them and before we can do anything about them. And so it can be hard to prevent thoughts, but we certainly can respond to them. And we're going to talk about two types of thoughts. Unrealistic thoughts or unrealistic worries are thoughts that we have that have a piece of untruth in them. So there's something about the thought that's just not quite right. And these kinds of thoughts are very common. We all have them. So this does not mean that your thinking is wrong or that there's something wrong with you. These are thoughts that everybody has, but they do have a little bit of a piece of untruth that we can sort of tackle. And then the second kind of thought is a thought that is true, but it's about a situation we cannot control. And cancer creates a lot of those kinds of thoughts. So we're going to talk about both kinds. So let's talk about unrealistic worries. Another way to think about this is thought errors. These are thoughts that have a piece of untruth. I've listed a couple of very common unrealistic worries here. So the first is all or nothing thinking. This is like black and white thinking. It means we're only considering the extremes, right? Things on the end. We're not considering options in the middle. So for example, a person might think, if this scan is bad, I'm definitely going to fall apart. So that word definitely means that that person's way out here on the extreme, right? They're not thinking about all the ways they might respond to a disappointing scan. And because they're thinking, I'm definitely going to fall apart, that's a really nerve-wracking thought to have. So anxiety goes up. Overgeneralization is when we take one thing and we apply it to everything. So we take one situation and we apply it to everything. So for example, I have a pain in my side. Oh, my cancer is back, right? So taking one symptom and just assuming that it applies to your cancer. Jumping to conclusions or imagining the worst case scenario is exactly as it sounds, right? We assume that the worst case outcome is definitely going to happen, right? So I know this scan is going to be bad, right? Haven't had the scan yet, don't have the results yet, but just thinking, I know this is going to be bad. So going to the worst case scenario. And of course, if we're always thinking about the worst case scenario, we are going to feel more anxious. Should statements are things I hear a lot. These are thoughts like, I should have eaten healthier, I should have slept more, I should have stressed less, I should be managing this better. They're sort of ways of criticizing ourselves, but that aren't exactly true, right? Aren't exactly true. Or the assumption is that if I had slept more, I wouldn't have gotten sick. And we don't know that that's actually the case. So these should statements are very self-critical, but not particularly helpful. And then mind reading is also a very common one. This is a thought we have where we assume that we know what someone else is thinking. And usually when we do this, we sort of assume they're thinking something negative. So for example, my oncologist is not making eye contact. She must have bad news. Like trying to read the oncologist's mind. And truth be told, we're just not that good at mind reading. But we usually assume that the other person is thinking something negative, which increases our anxiety. So if we're having these thoughts, they might not be quite right, but they are making us more anxious, right? Our anxiety is going up. So how do we catch whether or not we're having these kinds of thoughts? Here are some questions you can ask yourself to identify whether you are having thought errors. So one, are there extreme or exaggerated words in your thought? So these are things like always, forever, never, definitely. Very rarely in life is something that solid, right? Very rarely it does something always happen or never happen. So if you have these extreme words, you might want to stop yourself and think, am I thinking about this correctly? Is it true that this is always the case? If your thought includes the word should, you might be having a should statement. And then you want to think like, is that true? Is it true that if I should have slept more so that I didn't get sick? Is that actually true? Another way of addressing thought errors is to think whether there's an alternative explanation. Because sometimes what happens, particularly when we have something like a worst case scenario, we are assuming the worst, and we are assuming that the worst outcome is the only outcome. And that's rarely the case. So if you're having that kind of thought where you're thinking about a bad outcome, prompt yourself to think about other possible outcomes, right? Like the scan could be bad, but it could not be bad, right? And so really bringing to mind the other options will help decrease that anxiety. Are you focused on the negative and missing the positive? We all tend to do this, right? We can see the negatives because they feel very glaring, but we overlook the positives in a situation. And when we do that, and we only see the negatives, of course, that makes us more anxious. But if we can balance those out with the positives, our anxiety goes down. And then finally, sometimes simply asking yourself, is this thought helpful to me? And if it's not helpful, then think about like, why are we focused on it, right? If it's not helpful, let's find a different way of thinking. So once you've identified these thought errors, the next question is, well, what do I do with that, right? What do I think about instead? So I'm going to give you some examples here. So let's say that you have the thought, if this scan is bad, I will definitely need to quit working. So that word definitely is one of those extreme or exaggerated words, right? So that kind of cues us that this is a thought error. Instead of that, thinking, if this scan is bad, I will need to talk to my doctor about working and making a plan with my boss. So you can see, right, it's instead of saying, I'll definitely need to quit working, your thought is focused on what plan of action you could have if you needed it. Second thought error, the oncologist is taking a long time. The scan results must be bad. Jumping to conclusions, right? Worst case scenario. Alternative thoughts might be, the oncologist is taking a long time. She must be busy. Or he's always running late, right? So just alternative explanations for the worst case scenario that you are assuming. And then finally, I have a pain in my side. My cancer must be back. Instead of thinking that, alternative thoughts are, I did a lot of gardening yesterday. I must have strained a muscle. And if the pain doesn't get better in 2 days, I'll send my oncologist a message. So again, finding alternative explanations and then also having a plan for managing this situation, the pain, if you need it. So you can see, right, that these are just different ways of thinking about this situation that help bring down the anxiety because these thoughts are a little bit more consistent with what's actually happening. So those are thought errors. For the last piece of this, I want to talk about that other bucket of thoughts, the realistic worries. So these are worries that they're true. So unlike thought errors, they are true, but they're outside of our control, right? So we can't really do much about them. And these are really common in cancer. And I'm going to show you a few examples. These worries increase anxiety, so they do make our anxiety go up. And so often what we try to do is we try to control these thoughts, right? Like I hear people say, I just try not to think about that, or I push that to the back of my mind, or I push that down. I just try not to think about it. And then I often ask them, like, is that working for you? And what people will often say is, it works for a short time, but then those worries kind of come back to the front, right? They bubble up again. And that's true. So we're going to talk about a better way of managing that. What are some examples? So these are some realistic worries that people might have. Like, what if the scan shows the cancer is back, right? I don't know if the cancer is going to come back or not. That's one of the real challenging things about dealing with cancer. So this is a realistic worry, but there's not much we can do about it right now. Second example, I can't stop worrying about whether I will need treatment again. This is understandable, right? Of course you might be worried about this. But again, it's going to make your anxiety go up, but there's nothing we can do about it. Similarly, what if treatment doesn't work, right? Understandable worry, of course, a normal worry, but something that is going to make you anxious when there's nothing you can do about it. So like I mentioned, when we have these kinds of worries, often what we try to do is to control them. So I'm just going to show you some pictures that kind of illustrate this because it can be a little bit hard to wrap your head around. So in this figure, the monster on the right-hand side is the worry. And the man on the left is trying to control the worry, right? He's holding onto this tug of war rope. He's trying to pull on the monster, right? He's trying to control those thoughts. And because he's trying to control those thoughts, right, you can see how hard that is for him, right? Like he's putting all of his weight into it. He's sweating, he's grimacing, right? This is really hard work. And because he's holding onto this rope with both hands, he can't do anything else with his hands, right? His whole body and mind is focused on trying to control this monster, right? To control these thoughts. It's taking everything he has, right? What we want to do is instead of trying to control it like this, we want to drop the rope, right? So the monster is still there, right? The thoughts might still come because they're normal. But instead of being in a tug of war with those thoughts, right, he's more free. So how do we do this? The strategy is acceptance or willingness. So I'm going to go through what acceptance is, and then I'm going to know what acceptance is not, because that term can be a little bit ambiguous. So what is acceptance? First of all, acceptance is recognizing that the situation is stressful and that you're having particular thoughts and emotions, right? So recognizing that you're worrying about the upcoming scan, just noting that. Being non-judgmental, don't judge yourself for that. Right? Okay, I'm worrying about the scan. I understand why I'm doing that. I understand that that's normal. I'm just going to recognize that that's what I'm doing. Instead of trying to fight that thought, we're just going to let it be, right? We're just going to say, there it is, right? I see that thought, kind of like it's in a bubble above your head, right? Like a thought bubble, like, oh, I see that thought again. I see that it's there. I'm going to just recognize it and give space for it. And then, and this is the important part, I'm going to re-engage in the present moment, right? I'm going to go back to living my life, even though that thought is there. I'm not going to fight it. I'm not going to judge it. I'm just going to let it be and go back to living my life. That's acceptance. Now, acceptance does not mean that you're okay with the situation, right? We're not saying like, you have to just be okay with the fact that you have a scan. No, of course not. That's very stressful. So acceptance is not feeling that the situation is acceptable or that you have to be happy about it. We're just giving space for it and letting it be. Acceptance is hard. So I do want to note that. It's not giving up, right? You're not giving up on your situation. You're just not fighting it anymore. It's also not failure, right? Because what you're doing is you're stopping the struggle with the thought. And that struggle wasn't working anyway, right? The man with the rope is sweating and can't do anything else with his hands because he's holding on to the rope. So it's not that you failed, it's that you've stopped doing something that's not helpful to doing something that is helpful. It's also different than what we might call toleration. Like you might tolerate a blood draw, right? It's uncomfortable, but you know it's going to be over quickly and you just get through it, right? That's toleration. That's tolerating something. Here, what we're talking about is not just that you're going to get through something, but that you're going to use this strategy so that that thought isn't getting in your way of living your life, right? So that you're not that man clutching the rope, but instead you're this, right? You are, the thought might still be there, but instead of being in a tug of war with it, you're engaged in your life doing the things that you enjoy. So as I come to the end here, I just want to leave you with a couple of ways of thinking about acceptance. So the first is you can imagine that you're driving a bus, and in the back of the bus are a bunch of little kids. And those kids are your thoughts. And as you're driving the bus, right, the kids start to misbehave, right? They're yelling or throwing spitballs or whatever kids in buses do. And so you pull over on the side of the road and you calm the kids down, and then you pull back on and you start driving. And you're driving down the road of your life, right? You're driving down the road of your life, what it is that you do. But the kids act up again. So you pull over, calm them all down, pull back on the road of your life, start driving. The kids act up, you pull back over, right? So you're not getting anywhere. You're not living the life that you want to live. And so instead of pulling over, what we're going to do is we're just going to keep driving. We're going to take those kids right with us, and we're going to go down the road of our life, even though they might be doing things in the back. Leaves on the stream is an image where imagine these thoughts are leaves on a stream and they're just floating by. So you're aware of them, you see your thoughts, but you don't try to do anything about it. You just let them go. Some people also like clouds in the sky, right? Letting the clouds roll by. You don't try to pull down the clouds, right? You don't try to push them away. You just let them go by. And then finally, and this came from a woman I was working with who was worried about her cancer coming back. And she described those worries as a rock in her pocket. So she said, I don't like the rock. It's heavy. I wish I didn't have these thoughts, but I'm just going to put them in my pocket and take them with me doing what I want to do. So she was recognizing that those thoughts were heavy and that she didn't like them, but she wasn't going to let them stop her from doing the things she wanted to do. She was just going to carry them right with her. So these are some ways to think about acceptance and think about managing these kinds of worries that can help you keep living, right? Keep doing the things you enjoy, even though you might be having some of these thoughts. So that's my last slide. This is just a summary of the different strategies that we talked about. So at this point, I'm happy to answer some questions.
Thank you so much for that wonderful presentation, Dr. McConnell. Those were all super helpful tips. I didn't realize the tension I was holding in my jaw and shoulders until we got to the progressive muscle relaxation slide. So thank you for that.
Sure.
But yes, it's now time for the discussion part of today's webinar. So if you have any questions about today's topic, now is your chance to ask. As a reminder, you can ask a question or make a comment by using the Q&A icon on Zoom. We may not have time to ask everyone's questions verbatim today, but we will try our best to capture the overall message of all your questions and get through as many as we can. I also wanted to let you know that I'm going to be opening up a poll asking where you get your mental health resources. So if everyone is able to answer that, we can see where everyone goes for their resources and talk about that a little bit as well. So our first question is, what are some signs to look out for to know if I need professional help versus managing anxiety on my own?
That's such a good question. So I would say that if your anxiety is making it hard for you to engage in your daily activities. Maybe it's because you can't sleep and you're just so tired because the anxiety is so high. Or, maybe you're just worrying so much during the day that you can't focus on anything else. It's hard for you to, focus on paying bills, or it's hard for you to focus on work tasks. If your anxiety is disruptive like that, it's a really good sign that you need to connect with a professional. Um, if you feel like your anxiety is really interfering with your relationships, right? Maybe it's putting a lot of tension on your relationship with your partner or your spouse or your kids. That's another indication that speaking with a professional is important. So, and I would encourage you to do that. Now, that being said, even if you aren't even if your anxiety isn't causing that much disruption, it might still be helpful to connect with a professional. So even if you're kind of able to go through your day, but that anxiety is there and it's lingering, reach out to someone and get a little bit of help. I would also say that, if you've been feeling anxious, even if it's more of a lower level anxiety, but for a long period of time, like it's just not going away, seek help from a professional, because they might be able to give you some strategies to really just eliminate that anxiety so it's not so much a part of your life.
Thank you for that. And then our next question is, my most difficult time is getting up multiple times at night and then trying to stay calm to fall back to sleep. Do you have any advice for how to help with that at nighttime?
Yeah, this is so common, and I'm so sorry you're dealing with that. The nighttime is this tricky space, right, where we need it to be quiet with no distractions so that we can sleep, but then it's quiet with no distractions, so it gives our mind a place to think and worry. So I think some of the strategies we talked about can be really helpful. So guided imagery, because it gives your mind something to focus on. Also, that progressive muscle relaxation, again, because you can do it in bed. It gives your mind something to focus on, and while also relaxing your body. A couple of other things that I didn't mention in the presentation today. If you are in bed and you are tossing and turning and it is taking more than like 15 minutes for you to fall asleep, get out of the bed, go into a different room, do something relaxing, read, listen to music, meditate, something like that that's relaxing. When you start to feel tired, go back to the bed. The reason we do this is we don't want your brain to associate the bed with tossing and turning. Because then what can happen is the next night, as you're getting ready for bed, you're starting to think, oh, what if I can't sleep? I hope I don't toss and turn. And now you're anxious about going to bed, which doesn't help us fall asleep. So if you're tossing and turning, get up, go somewhere else, do something relaxing. Do try to avoid screens if you can. So read a book on paper, something like that, and then go back to the bed so that you're not tossing and turning in bed.
Thank you for that answer. And then we have a couple questions from caregivers and family members.
Sure.
So, how can I tell if someone needs or is having anxiety and needs help with it? And then how can I be helpful and supportive without dismissing their feelings?
Oh, two really great questions. So I'll take the second one. How can you be supportive without dismissing their emotions? And I do just want to note, being a caregiver, a loved one of someone with cancer is a very, very difficult situation to be in. So just sort of want to recognize that. So I think one thing that you can do is just remember for yourself that anxiety is very normal when someone is going through cancer. So it's not that your loved one is trying to be difficult or isn't handling things well. This is very normal. And you can also share that with them, right? To say that it's understandable that you feel this way. Like, of course you feel this way. You're going through something that's really hard. So just sort of normalizing that both for you and for them can be really helpful. And then saying something, like, even though this is normal, I think that, we can find ways to help with this so that it's not so uncomfortable for you, right? Just because something is normal doesn't mean we can't help with it. Um, and so the I have found that one of the best ways to do this is to ask questions, right? Ask the person, like, how are you feeling? Or like, I've noticed that you're not quite yourself lately. Like, do you have a sense of what's going on? and just see if you can get them to talk about what they might be experiencing on the inside. And then that might help you work with them to find strategies that will help, maybe some that we did today. In summary, sort of normalizing, understanding that this is a normal reaction, and then asking them questions to help understand what their experience might be. In terms of when might someone need help, this can be tricky because we can't force people into mental health care, right? It has to be their decision. But I think framing it as just another tool, right? Like another resource um, to help, right? Like if we have a headache, we take an aspirin, right? If we twist our ankle, we go to the physical therapist. This is the same thing, right? This is the same thing. And we want to use all of the tools and resources we have available to make our lives as good as possible. And mental health resources are just another tool. I know there can be some stigma around it, but really it's just another tool, just like any other kind of provider. And so framing it that way as just sort of another resource that will help make life better can help people be a little bit more open to accessing mental health resources.
Thank you. And then the next question is, this person heard that with progressive relaxation that you should tense the muscles first, relax them. What do you think about that?
Yeah. No, that's a great question. And you're absolutely right. That some forms of progressive muscle relaxation will have people tense the muscles first. And the idea is if you create more tension and then relax, the relaxation feels even deeper. And that's true. So if you want to do it that way, that's absolutely fine. The reason that I presented it without the tension is that if sometimes the tensing part can increase pain if people have like if they have a port, or if they've just had blood work done, or if they've had surgery or something like that. Tensing those muscles can exacerbate their pain a little bit. So I just eliminate that when I'm presenting this to sort of a broad audience of people who I don't know your particular situation. But certainly you can add the tension piece if that feels comfortable for you. Either way works.
Perfect. Thank you for that answer. And then that will be probably all the time for questions today, but I wanted to share the results from our poll. So it looks like a lot of people get their resources from HealthTree, which we definitely appreciate you all trusting us and coming to us for those resources. And it looks like a lot of other people also use Google to try to find resources. So, Dr. McConnell, I wanted to ask you if you have any other resources that you recommend
Mhm.
for people to go to when they need help with mental health.
Sure, yeah, absolutely. So, the American Cancer Society has a lot of good information about the emotional impact of cancer. So check out their website. The American Psychosocial Oncology Society is another professional organization that has great resources. If you're looking for like a mental health provider, the website Psychology Today has a tool where you can find a therapist near you. So you type in your zip code and it gives you all these profiles of mental health providers in your area. So that can also be a really good strategy. And then your insurance company can also send you a list of mental health, or they might call it behavioral health providers who are covered by your insurance plan. And so you can ask them to send you a list of people to contact. So those will be some places to start.
Thank you so much for that answer. And thank you again for this presentation and all your very helpful and informative answers to all our questions that we had today.
Sure, my pleasure. Thanks for the invitation. Thanks to everybody for being here.
Of course. And so as you leave the session today, we would appreciate you taking 2 to 3 minutes to fill out a brief survey about your experience during today's event. You can suggest topics that you'd like to see in the future, and we're always looking to cover what matters most to you, so we would really appreciate your feedback. I also wanted to quickly highlight a few of our upcoming events. So on July 1st, we have a webinar about avoiding Medicare Advantage traps and Medicaid eligibility pitfalls. And on July 2nd, we have a webinar about fighting chronic cancer. We also have a lot more exciting events in the works, so stay tuned. The link to sign up for any of these events and many others will be sent out in the follow-up email. We also have a number of upcoming in-person events. Connect to Cures allows you to connect with other patients, learn from doctors, and discover resources in your area to help you navigate your cancer. So if you're interested in attending any of these events, the QR code to register is on the screen. Once again, I just want to give a huge thank you to our sponsors, Pfizer, Adaptive, Cura, GSK, AbbVie, Amgen, Johnson & Johnson, Taiho, and Bristol Myers Squibb. Before we wrap up, I just want to say a huge thank you again to Dr. McConnell, and thank you to all of you for being part of our HealthTree community. Your support means so much, and we're so grateful to have you here. I've included my email on this slide, so please don't hesitate to reach out if you have any questions. Have a great rest of your day, and I hope to see you at another webinar soon.